So when you're getting started with your instrumentation, it actually took 5 years before someone told me that if I take my thumb out of the ring there, it's a lot easier to deal with. I actually end up holding it on this, or you can hold it here, try to keep it at kind of the first joint. What that does is it gives you more mobility. If you're trying to sew towards yourself and you're trying to keep your thumb in, you end up like this, and it's rather awkward. Whereas you can see how much easier it is if my thumb's not in it. And then you put it in when you're going to open it. As far as the forceps, you're going to hold the forceps lightly in your hand, hold the skin lightly. You're either going to go like this, or you're going to turn it like this, depending on where you're working and what's comfortable for the situation. When you load your needle, you're going to load your needle about 1/3 of the way down, and just about square, maybe angled slightly away from you. When you hold your scissors, again, this one you do one on your ring finger because it's easy to palm it and do something else while you're still holding it back like that. And then you can flip it when you're ready to cut. So use that when you're assisting a lot. And then when you want to do a surgeon's knot, when you want to start out, you always want to follow the curve of the needle. If you try to push a curved needle straight through tissue, it's going to bend this, and you're going to end up, it's going to straighten out more and more with a kink in the middle, and then eventually it'll break if you keep it up. So you get the needle where you want it. Once you get the needle where you want it, then watch the wrist. You start curving your wrist and follow the curve of the needle with your wrist. That usually gives you a good bite and keeps the needle intact. So again, I curve my wrist, you go down, perpendicular, follow the curve, and go up. And now when you tie, especially if you're starting suturing, it's a good idea to do a surgeon's knot. The surgeon's knot is you always go between your two strands if you do an instrument tie. Loop it twice. That's what makes a surgeon's knot. And then go and pull it through. And if you look, see how it lays there versus how it lays there? It doesn't lay as well. This is squaring it off. So you would square it off that way. Now, sometimes it holds and sometimes it doesn't. You use this at the beginning because it gives you a couple extra seconds, but if it didn't hold and started to loosen up like that, then, and you'll see it in some of the other videos, when you pull it, if you flip this the other way, it will hold it and keep it from, that's kind of locking it. So you do that at the beginning to help yourself, so it will hold until you can get that second throw put in. When you grasp that needle to take it out, you're always grasping behind the teeth of your forceps. If you try to grasp with the teeth, you can't get it. So you grasp behind the teeth, and you want to load right from down here near the skin. It's easier than trying to get something in the air and snag something in the air. You just keep it down here. And if you load straight from your forceps, then you're saving yourself a step rather than take it out. I used to take it out and then take it off and then use this, and you can see that takes an extra step. So just load it from your forceps as you pull it through. And you don't want to lift your needle up in the air when you get it through because you may have it out and contaminate it. Plus I actually hit a surgeon in the head with it when I first did that. You want to pull it through with this hand or else pull it through with this hand. But usually just like a pulley method. So I'm going to demonstrate that again. You just want to take it and pull it through. And that's how you get started.